I really want to express my sincere appreciation to the Ministry of Health for its continued leadership and partnership in advancing children's environmental health agenda in Lesotho. Decisions we make today, policies that we advance today, will determine the future of the children. And even though it often sounds cliche, I would say it again, our children are leaders for tomorrow. And if we don't get it right with them, we put our nations at risk of several challenges. We all know that lead poisoning and other environmental hazards have significant impact on the life and well-being of our children. And more importantly, as we talk about leadership for tomorrow, we know that lead has huge impacts on the cognitive function of children. A few months ago in February, many of us came together to validate the findings of the Children's Environmental Health Assessment Report. And that process provided valuable evidence on the environmental risks that affect the children in Lesotho and highlighted priority concerns, including lead poisoning, household air pollution, hazardous waste, wash-related risks, and climate-related environmental hazards. Today, we're taking the next important step in the journey. Now that we understand what are the challenges, now that we understand what the situation is, the documents and materials we will review over the next 2 days are intended to help us to respond to the issues that we found from the previous assessment. And how would we respond to these issues and challenges? It would be through stronger communication, through better advocacy, through awareness raising and capacity development. In particular, the assessments highlighted lead poisoning as a significant but often overlooked risk to children's health and development. It also demonstrated the need to strengthen public awareness and to equip communities, our frontline workers and institutions with knowledge and tools needed to prevent harmful environmental exposures. It is really encouraging to see that we have the right stakeholders in this room, because when it comes to the issues of environmental health as pertains to children's health, we cannot do it alone.